Tissue healing and wound care. The phases of tissue repair often overlap each other and can be hard to understand. The first phase is bleeding. It begins at the onset of injury, and the objective is to stop the bleeding. In this phase, the body activates its emergency repair system, the blood clotting system, and forms a dam to block the drainage. During this process, platelets come into contact with collagen, resulting in activation and aggregation. An enzyme called thrombin is at its center and initiates the formation of a fibrin mesh which strengthens the platelet clumps into stable clots. Phase 2 is the defensive or inflammatory phase. This focuses on destroying bacteria and removing debris, essentially preparing the wound for the growth of new tissue. During phase 2, a type of white blood cell called a neutrophil enters the wound to destroy bacteria and remove debris. These cells often reach their peak population between 24 and 48 hours after injury, reducing greatly in number after 3 days. As the white blood cells leave, specialized cells called macrophages arrive to continue clearing debris. These cells also secrete growth factors and proteins which attract immune system cells to the wound to facilitate tissue repair. This phase often lasts 4 to 6 days and is often associated with edema, arrhythmia or reddening of the skin, heat, and pain. Phase 3, or the proliferative phase. Once the wound is cleaned out, the wound enters phase 3, where the focus is to fill and cover the wound. The proliferative phase features 3 distinct phases. 1. Filling the wound. 2. Contraction of the wound margins. And 3. Covering the wound, or epithelialization. During the first stage, shiny, deep red granulated tissues fill the wound bed with connective tissue, and new blood cells are formed. During contraction, the wound margin contracts and pulls towards the center of the wound. In the third stage, epithelial cells arise from the wound bed or margins and begin to migrate across the wound bed in a leapfrog fashion until the wound is covered with epithelium. The proliferation phase lasts anywhere from 4 to 24 days. Phase 4, the maturation phase. During the maturation phase, the new tissue slowly gains strength and flexibility. Here, collagen fibers reorganize, the tissue remodels and matures, and there is an overall increase in tensile strength, although maximum strength is limited to about 80% of pre-injured strength. The maturation phase varies greatly from wound to wound, often lasting anywhere from 21 days to 2 years. The healing phase and process is remarkable and complex, and is also susceptible to interruption due to local and systemic factors, including moisture, infection, and local maceration and age, nutritional status, body type, as well as other environmental factors. The inflammatory phase, or days 0 through 6. The most common symptoms we see are redness or arrhythmia, local heat, swelling or edema, pain, and loss of function. During the inflammatory phase, we see an immediate vasoconstriction up to about 10 minutes. We also see platelet reaction or platelet plug or clot. We see a clotting factor, formation of a fibrin clot, and then vasodilation. Acute inflammation is a rapid response to an injurious agent that serves to deliver mediators of host defense, leukocytes, and plasma proteins to the site of injury. Acute inflammation has 3 major components. Number 1, alterations in vascular caliber that lead to an increase in blood flow. 2, structural changes in the microvasculature that permits plasma proteins and leukocytes to leave the circulation. And 3, immigration of leukocytes from the microcirculation, their accumulation of the focus of injury, and their activation to eliminate the offending agent. Acute inflammatory reactions can be triggered by a variety of stimuli, anything from infections, trauma, physical and chemical agents, tissue necrosis, foreign bodies, and immune reactions. The proliferation phase occurs from days 3 to 21. During this phase, development of new blood vessels or angiogenesis occurs. The fibrous tissue or fibroplasia also occurs, and the generation of new epithelial cells or reepitheliation occurs. The maturation phase can last from 1 to 2 years. We see a decrease in fibroblastic activity, a return to normal histochemical activity, and remodeling the tissue along the lines of tensile force. We may also see the formation of scar tissue. Depending on how the collagen fibers are laid down, the scar may be very noticeable or very minor depending on the size, length, shape, and location of the wound. Bone healing is a little bit different. It occurs in 3 phases. The acute inflammation lasts for approximately 4 days. During this phase, a hematoma forms, vasodilation and edema occur. In the next phase, repair and regeneration, osteoclasts reabsorb the damaged bone tissue. Osteoblasts build new bone tissue, and a callus forms. During maturation, some shape changes the overall structure and integrity of the bone forever.